Hi, this is a high-level presentation on the Department of State Health Services Public Health Region 7 Nursing Program. Region 7's public health nursing mission statement surrounds the health of the individual patient, the family unit, the communities in our region, and ultimately the population of our state and society. The Texas Department of State Health Services divides Texas into 8 different regions. Region 1 in the Panhandle area, Region 2-3 in the northern area, Region 4-5 north in the upper eastern part of the state, Region 6-5 south, more south on the eastern border of Texas, Region 7 in the central portion of Texas, Region 8 south of Region 7 and also borders Mexico, Region 9-10 in the western part of the state and bordering Mexico, and Region 11 bordering Mexico in the south. The headquarters office for Region 7 is in Temple. Clinic and field staff will travel to Temple for various trainings and events, but spend most of their time in their assigned clinics and communities. Region 7 is geographically split by Interstate 35 running from Hill County through to Hays County. There are a total of 30 counties within Region 7. 7 of those counties have local health departments. This means they receive funding from county and city taxes in addition to state and federal funds. The counties with local health departments, as you can see, are counties with larger cities and higher population rates. The only exception is Milam County, which has chosen to have their own local health department, but it's still quite small, with only 1 nurse and a few administrative staff, whereas all the other larger local health departments have numerous staff, large clinics, some have medical providers, and provide more extensive services. Milam County does receive additional assistance in state and federal funds from our regional TB department, so they are a bit different than like McLennan, Bell, Williamson, Travis Hays, and Brazos County. For the counties with local health departments, since they are still in our region, the region provides technical assistance and collaborates and coordinates in the event of a disaster situation. In the remaining 23 counties without a local health department is where our nurse and specialist teams live and work. Each reddish diamond spot on the map represents a clinic. We currently have 20 clinics in our region. Some of our clinics are leased or donated clinic spaces. Some are co-located with other state, nonprofit, or county agencies and staff. And some are basically offices we've converted to a minimal clinic space. Our clinics, depending on the layout and equipment, are designated as Tier 1 or Tier 2. Tier 1 provides minimal physical assessment opportunities and may not house vaccines or medications. Tier 2 clinics are full-service clinics with the space, equipment, and privacy for a full assessment and contains a vaccine refrigerator and freezer for our pediatric and adult vaccines, and also contains our STD and tuberculosis medications. When fully staffed, the nursing program has 35 staff members. We have 15 specialists. 1 is a specialist 2 and provides orientation and training to new and current staff. 14 RNs, 1 is a nurse trainer. 3 LVNs, 1 admin, 1 supervisor, and 1 manager. Our field staff are headquartered in one of their clinics. The Temple office is the regional headquarters where other departments in the region house staff and where leadership office is. The orange counties at the top of the map are assigned to our nurse trainer, an LVN, and a specialist. The counties in yellow are the east side team, the bright blue is the south side team, and the purple is the west side team. Each team has an RN that acts as a team lead. This map reflects the nurse specialist teams, their counties, and clinics. Noted on the left are the counties in Region 7 that do not have a clinic, but we're still responsible for providing services if needed. And for those counties, that typically means tuberculosis, perinatal Hep B, and pertussis. You can also then see the names of the team leads in the counties in their area, and the nurse trainer and lead PS is also listed. This map is provided to you in orientation and gives you a sense of which nurse and specialist are in which counties. Other nursing program staff are myself, Shelby Hyde, Program Manager, Sharon Torres, Program Supervisor, and Alexis Sapp, Administrative Assistant. Staff deliver all key services to individuals and the community. This includes immunizations, HIV/STD testing and treatment, tuberculosis testing and treatment, perinatal hepatitis B case management, pertussis case management, Title V community outreach and education activities, and preparedness response when needed. The PHR7 model differs from other regions in that PHR7 public health nurses give comprehensive care. This means all services are covered by the nurse within their assigned area. Other regions have nursing teams assigned to each type of service and serve as specialists in their department. PHR7's comprehensive approach requires a level of expertise in all services. Our nurses provide comprehensive care to their assigned counties and population. Benefits: nursing staff are the face of DSHS locally. They're intimately knowledgeable of needs and resources in their specific communities. Challenges: sometimes clinic staff must juggle multiple clinical priorities and be the expert in all fields. There are other DSHS agency departments within Region 7. Administration includes our Regional Medical Director, Dr. Sharon Melville, Deputy Regional Director, Carol Davis, Ashley Bruce Tago, Staff Services Officer, Penny Jones, Budget Analyst, Heather Clark, Customer Service Rep, and Mary Minix, APRN. Other departments are Birth Defects, Community Health Protection, Preparedness and EPI, HIV/STD, Immunizations, IT, Meat Safety, Social Work, Tuberculosis, and Zoonosis. Although at some point the nursing program interacts with all programs in the region, there are some we interact with almost daily. These programs are tuberculosis elimination, HIV/STD, preparedness and EPI, immunizations, and zoonosis. I created this illustration because nursing is like a hub for these services. TB doesn't often reach out to HIV/STD for assistance. Zoonosis doesn't much reach out to immunizations. But these programs depend a great deal on the nursing program to meet their client services and program goals. We work daily with staff from these programs. I've added this slide because you will see in here a lot about the Texas Notifiable Conditions List. It's updated yearly and provides a list of conditions that must be reported to the health department, and it also gives time frames for which they must be reported. As a community health nurse or specialist, the services listed will make up your workday. Each clinic provides eligible adults and children with immunizations. Patients referred for tuberculosis services, either TB infection or active disease, are evaluated and treated by clinic teams. HIV/STD testing and treatment is provided by each clinic team, as well as case management for other communicable diseases like pertussis and perinatal Hep B. Government performance measures and community needs will drive the community outreach and education your team will provide your counties. This could be, for example, attending a health fair, providing an educational presentation to a group, or meeting with the county judge or emergency management coordinator. Of course, special situations or diseases such as Ebola or COVID-19 will require additional education and response activities. Each regional staff member plays a part in preparedness and epidemiology, and typically the nursing program plays a large part. Examples would be if there was a natural disaster in Region 7 County, such as fire, tornado, flooding. Since I've been with the region since 2014, we've responded to wildfires in Bastrop County, flooding in Hays County, the fertilizer plant explosion in West, and of course COVID-19 testing and vaccination in all regional counties. Our nurses provide immunizations in the clinic for children and adults. They follow the complex vaccination requirements for the state and Texas schools, translate vaccine records from other countries, and they are experts on vaccine schedules for all ages and catch-up schedules. Our region is frequently called on to take a team to the Capitol to provide flu vaccinations to the legislators and their staff in the fall. The pictures on this slide reflect real instances in which our nurses are vaccinating in their clinic and in special situations like the Capitol. Our nurse and specialist teams receive referrals to evaluate and treat patients with active tuberculosis, TB infection, persons identified as contacts to a patient with active TB, and this would be during a contact investigation. Referrals also come from the EDN system. EDN stands for Electronic Data Notification and is a CDC immigration and quarantine notification program. Referrals for TB services come by various routes. It may be from a private provider, hospital, another DSHS region, self-referred, or a laboratory. Immigration notification referrals come in via the EDN system. Clinic staff work under standing delegated orders and have Dr. Melville and the regional medical director and Mary Minix, our APRN for clinical guidance. Patients with active disease during their infectious period are placed on home isolation, and a lot of the visits for those patients, initially with the staff wearing appropriate PPE, are completed in the home. Heartland and TCID are added to this slide because they're important resources for the TB and nursing program. Heartland National Tuberculosis Center provides medical and nursing consultation and technical assistance with various aspects of TB control at no cost to physicians, nurses, and other healthcare professionals in the 10 states that comprise the Heartland region. Heartland also develops and implements cutting-edge trainings for TB professionals, and it's very likely you will attend either in person or online many of these trainings. The Texas Center for Infectious Disease, TCID, is a public health facility of the Texas Department of State Health Services for the treatment of tuberculosis. TCID's outpatient clinic also serves as one of the state's Hansen's disease clinics. TCID is organized to provide patient care, scientific investigation, therapeutic and educational services in support of public health needs. On occasion, we will have a patient that we can't manage effectively in their home. Maybe they're co-infected with HIV, or they have first-line medication-resistant tuberculosis, or for some reason they're not tolerating their medications. Then that patient could be transferred to TCID to stay inpatient for stabilization on an effective TB drug regimen and then released back to our care in their home. There's numerous reasons a patient could be a candidate for TCID admission. While in TCID, patients receive comprehensive care, not just TB care. If the patient stays in TCID for an extended period of time, and this could be maybe 6 months, 9 months, 12 months, even up to 18 months, for their lengthy drug regimen, then they will receive assistance to find work in the area, attend school. It's a very comprehensive care facility. Heartland and TCID are separate entities, but they're housed on the same campus and coordinate frequently on patient care. When you attend a Heartland training or are involved in the transfer of a patient, you can ask for a tour of their state-of-the-art hospital, and they usually, as long as they have somebody available, will make those arrangements. Our nurse and specialist teams test and treat patients with sexually transmitted diseases. Referrals for services can come from our regional disease investigation specialist, private providers, other health departments, laboratories, or can be self-referred by the patient or the patient's partner. Staff make appointments in the clinic to see patients for STD services. Following our regional standing delegation orders, a medical history, physical assessment, specimen collection, and treatment is provided. Partner-delivered therapy is also offered. On occasion, these patients will be seen in the field instead of the clinic. Clinic staff also case manage other communicable diseases like pertussis. Referrals come from the region, private providers, labs, even the community. Nurses ensure the patient and contacts have access to medication and receive the appropriate vaccinations. If they don't have a private provider, our medical director, APRN, can actually order the medication from the DSHS pharmacy in Austin and have it delivered to the patient's home. Perinatal hepatitis B case management is initiated by a referral from central office in Austin or our regional epidemiology department, a private provider, or a lab. The clinic team will coordinate care with labor and delivery and the nursery prior to the baby's birth to ensure that HBIG and hepatitis vaccine is given on schedule. Then following release from the hospital, the case management takes a direction into coordination with the infant's family and pediatrician to ensure the infant receives the Hep B vaccines on schedule and has the appropriate lab work drawn demonstrating immunity. Title V is a term that's used when discussing population-based nursing and community outreach, which is driven largely by state performance measures. You will hear a lot about state performance measures. These include education and outreach about safe infant sleep, preventing shaken baby syndrome, tobacco cessation, heat stroke prevention, ATV safety, and drowning prevention. Title V is a federally funded program that supports services focused on women and children to promote healthy lifestyles and the prevention of illness, injury, and death. Areas of emphasis include healthy pregnancy and parenting, adolescent health, training of childcare workers, maternal and child mortality, minor human sex trafficking, and others. Regional nursing staff work with community members, organizations, faith-based groups, and healthcare providers. These activities are frequently completed in the field as educational presentations at events like a health fair or some community event. These photos are examples of regional staff performing community outreach. On the left, in Leon County, which is on our east side, we had a nurse and a specialist at a health fair, and then the picture on the right was done in our west side in Marble Falls, and it demonstrates a heat stroke prevention display that was set up by one of our clinic teams. The nursing program partners with medical experts, preparedness, epidemiology, agency leadership, and others to monitor for disease signs and symptoms in their community, education of individuals and the community on disease transmission, prevention, signs and symptoms, and provides referrals for support as needed. This would include emotional, spiritual, financial, and social service referrals. For example, in the photos on this slide, a team of regional nurses partnered with Texas Department of Emergency Management, TDEM for short, to test staff at a long-term nursing facility that had a high rate of fatalities due to COVID. All regional staff participate in emergency preparedness exercises in real instances. Preparedness exercises and responses follow the ICS incident command structure. Because of our skills, the nursing program staff play a large part in preparedness responses. Clinic teams act at a community level to establish a relationship with community stakeholders and support healthcare service planning and delivery during an exercise or event. They provide public health information and clinical advice to aid community response and recovery, represent the agency at meetings with community members, leaders, and other stakeholders. They also open pods, points of dispensing, for a vaccination or medication delivery system maintained at a local level to distribute medications or vaccines to community members, and also deliver direct client services as part of a medical team. The photos on the slides were taken at COVID-19 vaccination pods. Many of these staff you will be working with Our staff teamed with other regional program staff to set up, administer vaccine, and demobilize pods, and this occurred in most of our regional counties. This ends our presentation on the public health nursing program. Thank you.